Hi, everybody. I'm Michael Munson. Hopefully, you're here for understanding and responding to self-injury in trans communities. We are so happy to have the folks at Tilde here again with us. We've really enjoyed our long relationship, and are really happy that they're here to interpret English to Spanish today. And our newer friends from Pro Bono ASL, who we're thrilled to have here as well. So, if folks need to access ASL, hopefully you are seeing two people on the screen right now and the slide deck. And if you're not, I encourage you to reach out in the chat to Caleb or Emil, and they will try to help you get connected so that you can see the ASL person. So welcome. I am Michael Munson with Forge, and I'm really glad that you're all here. We've got a small group with us today, but we hopefully we'll have a really good discussion and conversation about self-harm and trans communities. We welcome all of you to be in this space, whatever you're bringing with you, whatever you want to set down, whatever you want to contribute. We really welcome all of you here. This is a learning space that hopefully all of us can learn from each other and come out at the end with some maybe new reflections or new ideas. Again, I'm Michael Munson. For a visual description, I am in my mid 50s. I've got grayish hair, gray beard, glasses, a blue shirt on, and a black t-shirt underneath. And behind me is a pretty much white wall and the side of a window and a side of a curtain. Let me just share with folks a little bit about who Forge is for those of you who might not be familiar. We are a 31-year-old trans anti-violence organization that focuses very much on providing training and technical assistance to victim service providers and other allied professionals. We do some work directly with trans communities, but because we are national, that means that those direct services are virtual in nature. We try to be survivor-centered, trauma-informed, culturally responsive, and empowerment-based. All of those words, hopefully wrap up to mean that we are sensitive and caring and responsive to current and changing needs of our communities and of the people that serve our community. Just a couple of asks and offers. What we ask of you today is to participate in whatever way you feel comfortable, whatever way works for you, to take care of yourself and your community and whatever that means for you, to embrace learning as it happens today, and to center survivors. What we offer you today is some options and ideas and experiences and a trans-affirming trauma-informed approach. So hopefully we will have, again, a little bit of a dialogue later via chat, and we can share some of those ideas. So our agenda today is pretty simple. It is to just talk about what is non-suicidal self-injury, kind of defining what that is, sharing what that means, looking specifically then at trans folks and non-suicidal self-injury. We'll talk a little bit about some blurred lines and what we have in terms of like perceptions and pathologizing and how do we think about the concepts and the realities of self-injury within trans communities. And then we'll wrap up with looking at harm reduction strategies. Hopefully you will hear harm reduction throughout our entire time today, but we'll be explicit about that towards the end of our time. I rarely do trigger warnings or content warnings, but this is just a reminder to folks that we're going to be talking about self-injury, self-harm today, and that's really heavy for a lot of people. So if that means taking care of yourself in a different way than you might on other days, please know that we are going to talk about some heavy stuff. And hopefully it will be you'll do what you need to do for yourself to stay centered or to step away for a little while. We are recording, so we will have the recording up in a couple of days, and you can come back to it if you would like to. All right, so let's look at kind of a simple definition of what non-suicidal self-injury is. And What's on the screen right now is a definition that's from the American Psychological Association. And they write non-suicidal self-injury is the deliberate, self-inflicted destruction of body tissue resulting in immediate damage without suicidal intent and for purposes not culturally sanctioned. And when I first looked this up again for this webinar, I kind of laughed because I don't know what culturally sanctioned means. I don't know what resulting in immediate damage means. I mean, I think we could kind of imagine what those two things mean, but this is a nice clinical definition, and it probably is going to cover a lot of what we talk about today. But again, what does it mean when we look at a wide range of self-injuring or self-harming behaviors? And that's going to mean the definitions are going to be different for every person about what is injurious to themselves, what they see as injury to others, and then what providers may classify as self-injury. So I just would like to, put that out there as like, this is what the American Psychological Association says, and we're going to talk about a definition that's probably going to be broader than that, but it's going to encompass what that captures. So if we look at kind of worldwide non-trans or trans and non-trans populations, so everybody, a fairly large study determined that around 17% of adolescents engage in self-injury, 13% of young adults, and even lower adults who are 18 and over, so 5% or so. So these numbers are fairly low in comparison to some marginalized communities. But it does show the range that it's often more prevalent in young people that engage in self-harming or self-injurious behaviors than in adulthood. And we can talk a little bit about that today, about how people may learn skills of coping in different ways as they age. There's a lot of different reasons why that may happen, and that would be a fun conversation that we can explore. When we look at self-injury, kind of the who of the demographics, again, younger folks tend to be the most discussed or the most researched of populations that engage in self-injury. And of young people, we know that there's a really strong correlation between childhood sexual abuse, childhood physical abuse, and non-suicidal self-injury. So young people are engaging in self-injury behaviors, and it's those children who have had sexual assault or physical assault that are more likely than folks who haven't to engage in this behavior. So again, a history of trauma or abuse is something that will oftentimes be a predictor of who is going to engage in self-harm. When we ask folks who do engage in self-harm, like how many, of you have had sexual or physical abuse during childhood, you can see that it's the majority of folks. So 79% of folks who engage in self-injuring behaviors have experienced childhood sexual or physical harm. Queer and trans people are at much higher rates for self-injury than non-queer or trans people. For those who are seeing the screen, this is my friend Emma, who's decided to join me today for our chat. And then the other piece of the who are folks that are socially isolated. So we know that when people are more socially isolated, either as children or as adults, they're more likely to engage in self-injuring behaviors. So we can look at the why, and this is where I think a lot of people that are not very familiar with self-injury start to think that any kind of self-injuring behavior is automatically suicidal. And so let's get out from the beginning that the behaviors that we're talking about today are not intended to be part of suicide, suicidal thoughts, suicidal actions. They're very, very separate from that thought pattern and that thought process and those behavioral patterns. So a lot of times people engage in self-injury as a method of coping, as sometimes their primary method of coping, to deal with a lot of emotional intensity or distress, to deal with negative feelings or feelings that they don't know how to work with in any other way, or to change a sense of numbness. So it's kind of the opposite of either to, feeling intense emotions and wanting to change that to less intense, or feeling numb and wanting to feel something. Sometimes people engage in self-injuring behaviors to communicate something to others. This is the lesser of these three bullet points. Generally, it's viewed as a coping strategy, but sometimes it is to send a message that says, "Hey, I'm hurting. I need attention. I need you to engage with me. I need something from you." And the last bullet on this slide is it's a symptom of an underlying emotional pain. So it can be a symptom of underlying depression or anxiety or something that's more chronic and ongoing, or it could be something more acute. Majority of people that engage in cutting or other self-injuring behaviors are doing so to regulate their emotions in some way, that it serves some function to regulate what's going on in their brain and their bodies, and to be able to come back to the moment or escape the moment. So I would love if folks are willing and able to participate in chat. If you could share what some of your ideas are, like what are some forms of self-injuring behavior? I just mentioned one, which is cutting, which is probably what most of us think about when we think about self-injury. What other kinds of behaviors would fall under that label of self-injury? And I had an internet lag, sorry about that. So headbanging, ingesting dangerous items, burning skin, substance use, restrictive eating, intentionally neglecting medical needs. Those are excellent examples. Yes. Burning. Yep. Thank you. Skin picking or pinching. Yep. So pinching at skin or scalp, sometimes pulling hair. Yep. What other things might fall under that self-injury category? You've captured a lot of what some very common ideas are and behaviors are. So thanks for contributing to that list. So you've mentioned some of these things. So cutting is one of the ones that we think about a lot. Most people think about primarily, but there's like burning or hitting or pinching or cutting or pulling, scratching or rubbing skin. A lot of it's a surface oriented behavior generally. So things that touch the skin or things that are about the skin. Um, Not always, but mostly. And most of the times, the locations of where people engage with these kinds of behaviors are on their arms, mostly on forearms, or sometimes on the upper arms, thighs, and belly. Oftentimes, it's in places that are unseen. So if you have clothes on, those things are not seen. When we look at trans people and non-suicidal self-injury, we kind of add another layer of things on top of it. So I mentioned before that trans and queer people are at a much higher rate of engaging in self-injurious behavior. Um, uh, One of the biggest studies showed that it was 8 times higher for trans adults to engage in non-suicidal self-injury compared with cisgender adults. So that's a pretty substantial increase or difference. Same study showed that about 56% of folks in the study that I'm talking about, experienced a lifetime, range of non-suicidal self-injury. So at some point in their life, they engaged in self-injurious behavior, and 21% said recently. And I think that was within the past year. So for trans people, like non-trans people, there can be strong associations with self-injuring behaviors and childhood sexual abuse, with emotional regulation, with social isolation. And many of us know that trans folks may be experiencing higher challenges with social isolation, or challenges with emotional regulation when there are a lot of things that are impinging on trans people's lives. So I'm curious if folks would like to share again in the chat, what are some of the reasons that trans people might be engaging in self-injury behaviors? So we know that abuse is one, we know that isolation is one. What else? Um, And I'm sorry about my cat who's very, very, very interested right now in being on top of me. So what are some other reasons that trans people in particular might be engaging in self-injury? So body dysmorphia, feeling out of control, body changes in puberty. Yep. So dysphoria, yep. Dealing with extreme emotional distress related to things like dysphoria or family dynamics. Being rejected by loved ones and not having proper supports. Yeah. Being criticized, misgendered, or feeling rejected. Yeah, all of those things. The lack of ability to get medical treatment that they want or need. Exactly. Yeah. The inability to maintain a job. So yeah, not having some of the basic things that a lot of us need every day. Mhm. Yeah. Not passing or not being able to be read as the gender that we are. Yeah. Yeah. That's a great, great list. Any other ideas that folks have about what might be some trans-specific reasons that people may engage in self-injuring behaviors? So lack of social supports, feeling of not being taken seriously. Excellent. All of those things, and more. So you've captured some of them that I put on the slide. I just wanted to add a couple of them, which you've already all mentioned, which are the concepts of gender dysphoria that trans folks may have that cisgender people don't have, body image issues, whether that's about gender or about size or about any number of things related to body, barriers to support, so not being able to access the support that is needed or wanted. And then minority stress, which several of you commented on, not using that word, but by using concepts that relate to it. So let's talk a little bit about minority stress and how that relates. So minority stress can also be called distal stressors or distal stress factors. So things that are happening outside of a person that is coming in. So things like discrimination, microaggressions, bullying, things that are with words or with physicality, things like prejudice, things like violence, things that we know that trans people are experiencing a lot of. Minority stress can also kind of be impacted by things like institutional or systemic injustice. So that might be in healthcare or in legal systems or in education or employment or in housing. It can be the loss of any of those things, like could have been something that somebody had and then lost because of trans identities or because of people's prejudice towards trans people. It could be losing contact with family or friends, some of those supports that are around. So all of those things can contribute to trans people feeling less able to cope and leaning more into possibly using self-injuring behaviors. So when we look at what forms non-suicidal self-injury takes with trans folks, we've got everything that you all mentioned before, everything that we talked about before. So those are all on the options for folks. But with trans folks, we sometimes see that if people are engaging in cutting, they're cutting on their chest or on their genitals rather than on their arm or their thigh, for example. So it becomes gender specific in the way that that self-injuring behavior is happening. There can be self-injuring behaviors that are related to things like binding, chest binding, or tucking or gaffing, using corsets or other things that body shape or mold our bodies. And we can look at this a little bit later and talk about, well, is it self-injuring or is it just a tool? Because a lot of folks wear their binders a lot of time, for example, and that may be something that they know may cause them, a rash or sensitivity or even difficulties breathing, but they don't consider it self-injuring, whereas somebody else might consider that as self-injurious. Trans folks might engage in different ways with eating or exercising, again, to enhance or make certain parts of their body more the way that they would like their body to be in a gendered way. So applies to everybody, but it may have that a little bit of trans spin on it with eating and exercising. And there might be different levels of risk-taking behaviors. for lots of different reasons. So that could be, from sex to chemical use to things like driving fast, to engaging in extreme sports or rough and tumble sports. So things that may cause physical harm or physical damage in ways through those behaviors. We know that self-injuring behaviors are often really, really highly pathologized. People don't always call it a pathology, but they're oftentimes not looked favorably upon, and people don't oftentimes see the person. They see the self-injuring behavior rather than what's going on, or the fact that like maybe, hey, we could talk with somebody, we could find out what's happening for them, we could see what they need. So I really want to remind us all as we go through today is just to when we look at somebody's behaviors, we don't have to pathologize, what they're doing or why they're doing it, but we can focus on what they need as a person and what we can do to support them in that process. So again, the reminder is that usually non-suicidal self-injury is a coping strategy. It's done for a reason. Um, and it's a response in general to an external or an internal reality or experience. So we can talk about some blurred lines with how we talk about what is self-injury and maybe what is not, and what tends to get pathologized more versus what gets pathologized less. Um, So a lot of times in our culture, and this is all American based, other cultures or other locations might be different, but in America, we place a lot of pathologizing woo and ickiness on people that engage in cutting or scratching or burning or hitting of themselves. Those things tend to get seen as, as really not cool and not good and things that are problematic. And yet our culture is less pathologizing and is more accepting or even glamorizing of behaviors that would oftentimes be considered an eating disorder. Um, Restrictive eating or excessive eating, high levels of exercise, um, doing things to change our shapes. So we live in this culture that's really focused on aesthetics. And trans people are affected by that culture as well. So a lot of folks get kind of a pass, and it's not pathologized when people are trying to achieve a certain standard of physical essence. We don't pathologize things like driving fast or having a lot of sex in general. So there's some things that we can look at and we can question a little bit why we may have different feelings about them, either personally ourselves or as a culture. And my cat is going to go up on the shoulder again. She's really loving y'all. Let's talk about some of the perceptions that we might all have when we look at what constitutes harm. So I mentioned binding before. Sometimes trans masc folks will bind 24/7 or bind, 20 hours out of 24. And for them, it might be a feeling of safety and confidence. It might be like, hey, I don't care how hot it is outside. This is what I need to do to feel okay in my skin and my body and my brain. They might not be bothered if they end up getting, like breaking out or getting a rash under their binder. And they can acknowledge the risks and know that there might be damage to their body, short term or long term, from that behavior. So that's kind of the one column of a person that may not perceive that to be harm or may not perceive it to be self-injury, even if harm is happening to their skin or their body. What happens sometimes when other people look at the behavior of binding 24/7 or many hours of the day is some people might think it's unhealthy. Like, why would you do that? You need to have air on your skin. If your skin is breaking out, you got to stop doing that. Like, don't bind for a couple of weeks and let your skin heal. There can be a lot of attitudes that go with you shouldn't do that behavior because it's not okay. People might have concerns about the long-term impact about folks' lungs or rib development or their skin or any number of things. So when we look at these kind of two columns, we can ask, hey, would this be considered self-harm or not? And I'm not going to answer the question because I think it really is dependent on, where people are standing in any of those camps, what their personal experience is, And does it really matter if we label it as self-harm or not? We give you another example of the perception of level of risk. So, if we take something like unprotected sex with many people, we could have the self person, the person that's engaging in those behaviors, say, I feel loved when I have sex with a lot of people. I am safer having sex with folks than I am walking down the street. I feel more protected from my partners than I am by my government. And that could be the risk assessment and the injury assessment for that person. Whereas somebody outside of that person might say, it's dangerous and it's risky. You shouldn't have unprotected sex, or you shouldn't have sex with a lot of partners. They might make assumptions about what kind of non-barrier protection they're engaging in, if they're on PrEP or not on PrEP. So they might have concerns about HIV or STI risks, and people may say, hey, you don't respect yourself if you're having sex with a lot of people. So there's a really big difference between those two people and that behavior. So we can't just classify that behavior as self-injury or as self-harm when it could play out very different for the intent or what people feel about those things. So another kind of perception piece is a perception about who might be at risk. So um, we can look at self-harming behaviors as behaviors that only affect the person that is engaging in that behavior, but sometimes those behaviors have a ripple effect. So let's imagine a parent and a toddler, and the parent is engaging in like matchstick burns. They light a match and they touch that match to their thigh, and they do it over and over and over again. And in theory, that would be self-harm. It would not be affecting the child in their house or anybody else in their house. But it does become an issue for the child if that match flies off and doesn't hit the skin and it hits the carpet and the house starts on fire. So when we look at some harm reduction behaviors around somebody's engaging in this behavior, we don't necessarily have to stop the behavior. We don't necessarily have to do anything about changing what that person is doing, but we might want to help them do that in a safer way so that it doesn't put other folks at risk and it minimizes their own risk to their own body. All right, let's look at managing responses. And Emil, if you'd like to join me, let's have a little bit of a conversation about this. I want to share with you like a very brief scenario. And Emil and I were going to do a little chat about it, and we'd love to hear your input in the chat as well. So Emil, if you're around, it'd be great if you want to come on camera. Uh,
I'm here.
Great, excellent, thank you. Um, so let's read this example. So the case example is that Bex shows up for an appointment at an advocate's office in long sleeves, even though it's 90 degrees out. They aren't making their usual level of eye contact with their provider. And you ask them, you, the provider, ask them, hey, what's going on, Bex? And after a while, they end up rolling up their sleeves, maybe because they're hot. And you see that there's a fresh row of cuts on their arm. So let's have a conversation, Emil, about like, kind of, you don't have to share what your first reactions are, but what could some of first reactions be to seeing that when you didn't necessarily expect that?
Um, I mean, one of my instincts is like that there's a level of trust there. Hopefully that's a sign that Bex is trusting us when we didn't ask specifically about self-cutting or anything like that, and they offered it. Um, I though like without way more backstory, I also know there are situations where somebody might feel pressured or coerced, like this is something I have to tell an advocate or a therapist about, and maybe sharing out of like a sense of shame or pressure rather than a sense of trust and wanting, like to talk about it. Um, I have seen, and I mean, probably a very long time ago, might have had an initial first reaction of like kind of fear or anxiety around like, what do I do? Are they okay? Um, is this our first time talking about cutting or self-injury of any form? Did I know about this before? Are they trying to stop? I think there's like a kind of a whole lot of background questions that come up for me. Um, but I think really making sure that my first reaction is one that doesn't show any judgment. I mean, like it, genuinely, my reaction is like, thanks for sharing, like offering this up. If you're showing me that, it sounds like you want to talk about it. Is that right? Um,
Yeah, that's what I was gonna ask you too. Is like, does it? Do you say something, right? I mean, you've got your own reactions, but then does the person say something acknowledging what is on their arms, or do we wait?
yeah. I mean, my read of that description was like that Bex like showed
Mhm.
me, not a like they rolled up their sleeves casually as part of it's hot in here and I noticed, but that it was a demonstration. And I think those are separate situations, right?
Yeah.
So if somebody's, clearly taking an action, then I want to ask, like, you're showing this to me. Do you want to talk about it? What do you want to tell me about your arms? What do you want
Yeah.
me to know? And it's something very, very open to let them lead the conversation. Um, but
Yeah.
I might have a different response if it was a more casual observation.
Hmm. And I like how you just, offered some phrases which are like, kind of like, what do you want to tell me about this? Or what do you want to share with me about this? Not like, oh, did you do that? Or what's wrong? Or, yeah, I mean, it wasn't loaded with anything. It was a very wide open question of like, hey, do you want to talk about this? And the answer could be yes, the answer could be no. Um, and so I'm curious, like, if you were sitting in that provider's chair and Bex, you ask the question, hey, do you want to talk about this? And Bex is like, heck no, don't. What happens then?
Yeah, then okay,
Heck no.
we don't need to talk about it.
Exactly.
I think I'd say like, you know, thank you for showing me and for setting that boundary. Um, if if that changes at any time, like we can talk about this.
Yeah.
Um, and I think depending on my relationship with Bex, I might say, would it be okay if I checked in with you in
Yeah.
the future?
Yep.
Um,
Yep. Right.
um, and I see in the chat one person says, asking how they're feeling, showing it to me.
Mhm.
And I think
Mhm.
that's another good way in, like, you know, um, you haven't we haven't talked about this before. How does it feel having brought this up? Um,
Mhm.
and yeah, they also this in the chat mentions assessing for medical care. Um, and I think that I mean there's just such a huge spectrum there. Like um if of like when I'm gonna say, oh, there's active bleeding, like
Right.
maybe we can handle that um before we continue talking or I see clear signs of infection. Is there support I can offer you around that? But I in my experience working with people with self-injury, it's really, really rare that what they're showing to me or what we're talking about is gonna actively need medical care right then. Um, what are
Yeah.
some
And
of
it's, I
your,
mean,
yeah.
and what you said was really important too, which is like right then, because there might have been a time that there would have been a need for medical care, but generally it's not going to be after somebody is, taking the bus to your office and or being in that same space with you. Um, I was thinking about when you were just mentioning something, and I seen in the chat about medical care. I knew a therapist that worked a lot with trans folks and childhood sexual abuse survivors, trans and non-trans. And she used to keep, this is a long time ago, I don't even know what they're called anymore, but those little like strips that will hold your skin together. They're
Mhm.
not band-aids, but they're like a non-stitch stitch for that exact reason. So that if somebody needed to have some of their skin pulled together a little bit, that could happen. in their office, in the therapist's office, rather than becoming a medical issue when it wasn't necessarily a medical issue, or it would raise a lot of questions and may cause somebody to be institutionalized in a way that was not going to be helpful for them at all. So, Emil, if you could share, I'm putting you on the spot now. What if somebody had a really strong visceral response to seeing cuts on somebody?
Yeah,
What
I
can they
think
try to do?
I I mean with anything, there's so many things that can cause us as advocates or professionals to have a strong response. And so preparing ahead of time, right? Like as much as possible, kind of being self-aware about what are some of the things that might cause me to flinch emotionally or physically, um, can help prepare for that. And just trying to take a pause before responding, really, can be really helpful. That just gives us a chance to like wrap our heads around things, and process through what is my like, you know, first reactions sometimes come from a place of bias or stigma or like, mainstream conceptions, and not necessarily from our values or like what we've learned over time. So giving ourselves that time to get from that first response to the deeper, truer one, can be helpful. Um, so that would be a starting point. I think, if you do have a reaction that Bex is noticing, it's okay to name it and say, um, I realized I made a face and I think you saw that. Um, and I just want to be honest that I was surprised, or I had an initial reaction of being upset because I care about you and
Right.
that looks painful. But I want you to know that like this is a space where it's okay to talk about this without stigma, that maybe I don't have to report your injuries to anyone else. We can talk about what's been going on for you. All of these things I'm saying, I notice also imply that I know that they're self-injury
Self-interest.
behaviors.
Yep.
Um,
Yep.
so,
Exactly.
speaking from like a domestic violence role, I
Yep.
not being out of self-injury training, I may have a different set of questions of like, assessing whether it was self-injury or somebody else causing harm. But either way, it is okay to acknowledge your reaction and then clarify like what your intent is in terms of judgment and bias.
Yeah, thank you for adding, because I think that is really what the necessary components are. It's like sometimes we have reactions, and if we say, "Hey, it's because I care about you," or like, you express something that says, "I'm with you. I'm still with you. I'm here. I'm not going anywhere. Thank you." All of those things that get paired with it, that initial response is going to fade a little bit, and people are going to see what the true part is. Yeah. Um, if you had one or two things that you would say, these are the things not to do, not to say, what would
Um,
they
don't like scream in horror and, oh my
Right.
God, why would you do that to yourself?
Hmm.
Don't call the cops on them.
Nope.
Don't institutionalize someone. Um, I, yeah, I think really, really trying to like not stigmatize, you don't even, in my opinion, you don't even need to have a goal beyond I'm here for this person and understanding what they want to share with me and what they want to get out of sharing that with me.
Hmm.
Um, I don't want to impose my own ideas or goals of what their future should look like.
Perfect. And that's exactly what I was hoping that you would say in our unplanned. Don't call the cops. Don't institutionalize. You don't have yeah, you don't have to go to those places. So yeah, thank you. And I'm seeing in the chat, like, comments. These would be comments to say, which would be like, you're not in trouble. Reminding people that, it's okay that they brought their wholeness into that space with you,
Mhm.
which is really great. Thank you, Emil. That was
Yeah.
fun. All right. So sometimes we need to start the conversation. Sometimes the conversation is started for us. So, like in that scenario, Beck started the conversation by rolling up their sleeves. They may not have spoken that. They may have had some conversation about it afterwards. A lot of things we don't know about in that scenario, but that was the start of a conversation. So I'd like to shift us a little bit to like when we, as supporters, helpers, advocates, people in a role on the outside of a person that is possibly engaging in self-injuring behaviors, how can we start the conversation? Do we need to start the conversation? And I think that's the first question is, do we need to start a conversation? And if we need to, why do we need to? And really questioning ourselves about that before we engage with somebody, to know what our intentions are, to be really clear about that within ourselves before we engage with somebody else. Um, so being really clear, like if we want to say something, if we want to open that conversation, who is it that really wants to talk? Is it us that wants to talk, or are we hoping that they will want to talk? Are we trying to make it a space that invites conversation, versus kind of demands conversation? Emil kind of referenced before a little bit, that sometimes people feel a little bit coerced if they are like receiving care from someplace and they feel that, hey, well, I've got to tell because I'm in this place, and if I don't tell, then I'm not going to be like able to get services. And so there's some of those things that happen that people may feel that they have to disclose something when they don't really want to, if they didn't feel that pressure. So again, just kind of thinking about, you know, whose desire is it to talk about or to have an engagement around that self-injuring behavior? What's the relationship like? So is it somebody, that you've been working with for a long time? Is it a new relationship? Is the person below 18 or above 18, which has some different legal implications sometimes, some places? Um, is the conversation's intention to help reduce stigma and shame, not increase it? So how can there be some openness in that discussion that, really just wipes that stigma slate clean and says, hey, you don't, it's okay that you bring this here. It's okay to share this here. Can you confirm that you will keep their information confidential? What does that look like? What can you tell them about where it will be kept confidential or private or anonymous? Um, Making sure that those agreements are known, so that safety can rise a little bit. I don't think there's any safe place, but there could be a safer place, if we work on creating that container. And is there privacy? If a conversation is happening and it's, within earshot of other people, or at school where other kids are around, or wherever it is, is there a place that has a little bit more privacy that can have a little bit greater relative safety? So again, kind of mentioned about, like, what are the goals? What's the intention of having that conversation? Are we supporting them in the care that they're seeking from us? What are they seeking from us? And does it have anything to do with their cutting or burning or binding or any of the behaviors that we might see as self-injurious? If that's not part of their goal to talk about those things, maybe we don't talk about them, or we let them know that we're open to talking if and when they want to. Again, I mentioned before, like, people might be worried about losing services, and that can go both ways, right? They might be worried that, there's some power dynamics around, well, I have to tell, and if I don't tell, I'm going to lose my services. Or if I the opposite of that. So I either have to tell or I need to keep it hidden in order to not lose my services. So just being really mindful of what those power dynamics are in relationships. If somebody's getting housing from you, they may be really careful about what they do or don't share with you. And as Emil talked about, and is really important for us to think about whenever we're looking and working with folks is, there can be a lot of concerns about forced institutionalization, if there's disclosure of some kind. And our world has not gotten better about some of those things, which is really sad. So, being institutionalized is not something that hardly anybody wants. And it's oftentimes really an unsafe place for folks, especially for trans folks, especially for folks of color. So we want to be really careful to um, not let that happen if that's possible, and to let folks know that we are not going to take those actions so they can feel a little bit more comfortable in sharing if they choose to. All right, I have got it's a fairly long video. It's an 8-minute video. And the video is of Cabe Jackson talking about their self-harm behaviors and the responses of adults in their life. So I would love for us to listen to this, watch this. It does not have captions, unfortunately, and there's no ASL with it. So if folks can keep on doing both of those things, that would be really super. And let's have a conversation about this at the end of watching it.
Cutting myself like before and after this incident, but like this was such a like distinct memory for me that I wanted to like share. So I typically would cut myself like on my inner thighs. I don't really know, like I can't give you some like elaborate like reason why I cut myself. If I could go back and like tell myself like what was wrong, like I would like definitely tell that kid that like, hey, what you're going through is like panic attacks. And like at the end or towards the end of the panic attack, I would like cut my inner thighs because that would like relieve me. I think more so, like looking back, it became like a habit, and like I would think that like, oh, the only way to stop this panic attack is to like cut myself. But yeah, that's not really a part of the story. That was just a little like background on like what sort of cutting I did. But whenever I got cut, I was actually cutting my arms. I don't know why I was cutting my arms, and I do remember like my volleyball coach like. So I play volleyball, by the way, and I remember like always trying to be really careful about cutting my arms because I knew that it would hurt whenever I would go to practice. So again, I don't know why I like cut my arms that day, but I did. I think I thought like we didn't have practice or something. Anyways, I cut my arms and like my volleyball coach noticed, and I remember like feeling scared that she was gonna tell, but she never told me that she was gonna tell. But like I ended up having to go to the guy, like the guidance counselor, like requested to see me, and I don't remember who the guidance counselor was or like what that conversation even looked like. I was probably like scared out of my mind because like I knew going to the guidance counselor meant that like they were gonna like call my parents. But I remember they like gave me the option to choose like which parent they would call. So I like chose my dad because I was like he won't care that much, so like I should like call him. But then like of course he's gonna like tell my mother. So like yeah, and I don't remember like the opening conversation, but there were like distinct phrases or things that like my parents said that I like still hold on to this day. Maybe not hold on to, but that I still remember to this day. Which was, so we were at the dinner table, like eating dinner together. I have siblings, so my siblings were there as well. And my dad thought it was like funny to like make a joke about it. So like we had like a fork and knife or whatever, and he was like, "Oh, make sure that name doesn't like take the butter knife, or else like she'll cut herself." And I don't know, like looking back, I'm like, this is your response as a parent. Like, out of all the things you could say, you decide to say this. What? So that was like one of the first things I remember him saying. And then two, he said, like, next time you should just cut up the river, not across. And I'm like, and that's the thing that like hurts the most because like that made me feel like ashamed and like guilty and like embarrassed and all those things. And I guess like shame and embarrassment does stop behavior, but like it's not the most effective way to stop behaviors because like then I just feel as though I'm the thing that's wrong, you know? Um, and then the third thing he said, which is like after dinner, I'm pretty sure, he was like, because also I should include, usually when I cut my thighs, I would use like my razor. But the time that I cut my arm, I had used his, I don't even know what it was. It was like a box cutter thing uh, that belonged to him. So I think like my mother thought it was like his fault because he gave me access to that. When like really like instead of figuring out whose fault it was, it should have been focused more so on like why is our kid doing this? Like what help does our kid need? Things like that. It was that was not a part of the conversation. Or if it was, it wasn't like an overwhelmingly like dominant message of hey, we want to help you. Hey, we want to like show you that there are better ways or better things that you could be doing with your life. Um, that was not the message I got. The message I got was like, why do you want attention? Like, why are you like making us look bad as parents? Or why are you doing this? It wasn't like, hey, we don't really understand why you're doing this, and we have never done this, but we do love and care for you, which is like the message I should have received, but you know. Um, anyways, the third thing that he said to me was like, next time, like, don't use any of my stuff to do it, which is like cool. Like, I'm glad your main concern in this situation is like you being to blame. Like, and I get it. Like, I guess that came out of like fear because like that day it was like self harming. Like, who knows when or how like I would have maybe done a lot worse to myself. So yeah, those three things that he said to me like have stuck with me for a while because I'm just like out of all the things that you could say to your kid, like why would that be one? Like why would any of those individual things be one? Like during a, I guess they just didn't find it serious enough, or I guess this was like a coping or like a defense mechanism for them to just sort of like dismiss the issue as an issue because like if you don't categorize it as an issue, then it's apparently not an issue. And I think after that, they thought that I was like fine and like no longer cutting myself, but like I still just continued to cut my inner thighs, and I was like, I'm never cutting my arm again. This only confirms that like people who cut their arms like get in trouble. Because like in my mind, like if you cut anything that was like visible, then you would just get in trouble. Um, and I guess there wasn't much thought processing beyond that. Um, okay, at this point I'm rambling and I'm not sure how to end the video. Um, this only confirms to me that like parents are not perfect people and that those who I like looked up to and thought of as like leaders and like positive people in my life weren't necessarily that, or like they were positive in some ways and not positive in other ways. And uh, yeah, that was my like first time I got caught self-harm story. Um, my parents did not take it seriously and decided to make jokes about it, and those jokes hurt and made me feel just like shame and embarrassment instead of making me feel like loved and cared for, which is like what you would hope your child would feel, right? Um, in the
So I found this video to be really very touching and very real and very obviously very real, but very um, the way the story was told and the messages that came out in it. Um, I'm curious what people thought about this video. I don't have to worry about the questions on the screen, but like, what did you think about the video? What I'm seeing one comment here, which is this part of the story really highlights how shaming folks only forces them to hide the behaviors, not stop them. Yeah. So what messages did Caleb did Cabe hear in from their parents. We heard, shame, embarrassment, guilt. What other things did they hear? It says Cabe heard that it was better to hide it, but their parents didn't know how to deal with it and made them feel worse. Yeah, yeah. Did anybody see anything that was done right in this story as it was being told? Any of the adults act in a way that was possibly helpful? I know you only heard it once, and I've heard it a couple times. One of the things that I found positive in a minimal sort of way was that the school guidance counselor said, "Who do you want me to call?" and gave some level of choice in that. Don't know what the rest of the interaction was like, but that was at least some amount of control and power that they got in that moment. So the other comments in the chat are, I think it also highlights the stigma around these behaviors rather than focusing on emotional distress. They saw it as attention seeking, right? That's what it certainly sounded like. Another person writes, it seems positive that the guidance counselor made an attempt at support of some autonomy by letting Cabe choose which parent to call, even though that wasn't ideal in the end. Yeah, yeah. What messages would have been helpful, do you think, for Cabe to hear? Or what actions might somebody have been able to take? So in the chat, it says compassion and a quest for understanding rather than judgment and shaming. Yep, for sure. It seems like Cabe could have really benefited from hearing that they weren't bad for self-harming and that the adults were going to get them support and take them seriously. Yep. Opening the door for vulnerable conversations. Yeah. Maybe if the parents pulled them aside and said, "Hey, let's talk about this when we're both available." So anything that would open the door and not reinforce shame. Um, so another comment is even asking Cabe about it. It seemed like a conversation wasn't really able to happen at all. Yeah, didn't sound like it was happening at all. Or maybe the counselor providing some education to the parents. That's a great thought. Yeah. Cabe could have benefited from being centered versus the parent centering themselves. Focus more on the inner experience versus others' external view or judgment. Yeah, excellent. Another comment is it might have been helpful for the guidance counselor to invite the parents in person and have the conversation be collaborative and open. Yeah, great idea. Um, Nice would be for parents to reach towards their kid rather than retreating into concerns about their self-image or distracting issues. Yeah, yeah, yeah. So how Cabe reported this was it certainly became all about the parents, not all about them. It didn't seem like there was any concern about their feelings, their emotions, what was going on, and a huge presumption that this was like a one-time deal or that it wasn't going to happen again. So all of those things are, all of what we just talked about, all what you all so smartly wrote in the chat are things that, this is what we don't want to have happen, this is what we do want to have happen by being present, being attentive, being accessible. Yeah. So let's break down our time a little bit by talking a bit about harm reduction in some ways. Um, we've talked about this throughout. We've talked about, how we can either reduce harm of the direct behaviors that are happening, or how can we support people in a way that is not going to escalate harm in any way. And since you're all going at the chat, which is really good, let's do a little bit more. So, what can we do to reduce harm from non-suicidal self-injury for trans and non-binary folks? What can we do to help that harm go down? Whatever role that you might be in or that somebody else might be in. Some of what I've been seeing above is, like invite conversation, like with the guidance counselor and with the parents in that one situation. But in a general sense, we could, invite conversations that have multiple people be part of them if that makes sense or is appropriate. Um, to focus on the person that's engaging in self-injury versus on somebody else. So I'm seeing in the chat, supporting folks in finding affirming mental health care and accessing affirming community so that they have less emotional distress and more sense of belonging and support, right? So if some of the reasons are emotional distress or isolation, how can we help that person get connected to resources that they may want or may benefit from? So another person is saying offer the app Calm Harm, which is to provide coping skills for self-harmers. Yeah. So brainstorming with the client, alternative or healthier behaviors, and to aid with coping. Using correct name and pronouns, find supportive peers and adults to walk alongside them, connecting them with appropriate resources. Yeah, those are great things. Increased supportive adults refer to skills groups as appropriate. For example, like LGBT focused DBT groups, dialectical behavioral therapy groups, referral to non-clinical peer support groups or resource centers. Yeah. So making connections to other people and other supports, if that's desired. Sometimes it's really hard to go for people to go and be with other people to get support, but sometimes that's really, really desired and necessary and really, really helpful. Yeah. So the person that said use name and pronouns was thinking along the lines that I tend to think of when I tend to think about harm reduction and self-injury, which is like, how can we offer affirming care for everybody? Trans affirming care, gender affirming care. How can we offer care and support and love for our fellow human beings in this world on this planet? How can we make sure that people have legal protections? Um, which there are fewer of today than there were several months ago or several years ago. How can we make affordable and accessible housing? How can we reduce some of those barriers to basic needs and access? Um, can we lean into teaching diversity, equity, and inclusion rather than banning it in schools and workplaces? Can we have things like employment non-discrimination? Can we have access to things like safe sharps, safe needles or razors or blades? Can we have places that are judgment-free zones? And those could be places that we can access sharps or needles. It could be places that we are sexual, or places that we can drive our car really fast or drive a mini car really fast. Is it a place that is a safe and judgment-free zone that we can use chemicals where there's a little bit more extra support around um, in case something happens? Can we offer judgment-free transportation to and from places, wherever those to and froms are? So how can we kind of look at that holistically and structurally, not just how do we reduce the harm of a behavior by one person, but how can we help that person feel more supported and loved and cared for and have those emotional skills, those cognitive skills, those behavioral skills um, that may include a wider range of tools than just the ones that they're using. Other ideas that folks have, I'm seeing there's a couple of others in here. A shout out to TACT. They have a free peer-led support group for trans folks. That is excellent. We will put that in the follow-up. Excellent. And somebody said that since cutting can be a ritual, helping identify the thought process when they're getting into ritual mode, what's going on, what are some other options? Exactly. Yeah, those are excellent. Thank you for all those suggestions. As we wrap up today, I just want to remind folks where you can find us on social media. We're on Instagram and Facebook and Blue Sky right now. So come and find us. We love to be friends with folks and learn from each other. If you'd like to reach out to me directly, you can find me at tgwarrior@forge-forward.org. I really want to thank everybody for being here today, and thanks to our Spanish interpreters, Spanish English interpreters, and to Pro Bono Interpreting for providing ASL today. So thanks everybody for being here.